Hello and welcome to this audio and visual presentation of the pros and cons of 3 different childcare facilities, being completed by myself, Mr. Nick Douglas. Get to our next one here. We're going to be reviewing 3 different handbooks. First is the Church Affiliate Handbook, the Community Christian Preschool, and their mission statement is to nurture young children in the love of Jesus Christ and to provide each child a positive introduction to formal education. The public school affiliate, public school affiliate is the T-Bird Learning Center, and their mission statement is graduating every student career and college or college capable. Then the next handbook is the Federal Handbook at the UCI Childcare Center. The mission of the UCI Childcare Center Childcare Advisory Committee is to ensure high quality and affordable childcare for students, staff, faculty, and community members. Pro 1 of the Federal Handbook is that it is accredited by the NAEYC. This childcare facility is accredited by the NAEYC, which is the National Association for the Education of Young Children. That organization set standards for childcare that centers need to follow. Now, all centers have to follow this, but to get accredited, a center has to go through a lot of paperwork, inspections, and the organization has to come and evaluate how they operate. So when they accredit you, that means that you are not only running appropriately, you are running well. Number 2, for their pros, is that they practice cultural competence. The UCI Child Care Center has the goal of cultural competence, as stated on page 9 of their handbook. Cultural competence is recognizing and appreciating the diversity that is around you, and that is growing ever more important as our culture progresses. Pro number 3 of a federal handbook is that this child care center, UCI, provides nutritious meals and snacks for their students. I've stated on page 20 of their handbook, nutritious meals are part of Goal 1 of quality early education programs and maximizing children's health and wellness status on page 21 of Robinson 2016. The first con is that parents who are late to pick up their children are fined, with a $20 fine being enforced after the first 15 minutes that a parent is late. Although it is reasonable to fine parents who are late, there should be some other means of recompensing the situation if the parent can't afford to pay that fine. Con number 2 of the federal handbook is that teachers are responsible for health evaluations of students. At this center, teachers are responsible for the health evaluation of the students, as stated on page 20 of their handbook. This is dangerous, as you and I know teachers are not health professionals and are not qualified to evaluate a student's health. Yes, they can check for a fever, the forehead is hot, but as far as medical knowledge goes, they are limited in that aspect because they're not nurses or doctors, they're teachers. Con number 3, there's a large amount of forms for parents to fill out. Parents are required to fill out numerous forms, which is a drain on parents' time and lack of respect for their busy lives of parents, which is found on their forms section of their handbook. I understand the need for the forms and the information, but there are ways to streamline the process, and this facility seems to want to fill out more forms rather than streamlining that process. Next up is the church affiliate, which is the first pro of the church affiliate. Now let's go back. The church affiliate is the Community Christian Preschool, and we'll go all the way back to pro 1. The first pro of the church affiliate is that children learn through play. This handbook states that this center believes that children learn through play in their handbook on page 5, which aligns with the physical activity goals of child care programs in Robertson at page 258. Children do learn best through play, and it's important that centers recognize that. Pros number 2 and 3 are the required health history and emergency contacts page. This facility requires parents to submit a health history of their student which is great to promote the health and well-being of all students, stated on page 11 of their handbook. Parents are also required to submit emergency contact information for each student enrolled, which is also beneficial for the health and wellness of all students. Having their health history and their emergency contact information is very important. Say if there was an emergency and you contact someone, you knew who that was, and then you know allergies, you know past illnesses, past injuries, which is helpful for health and wellness of the rest of the students. The cons of the church affiliate: the Cornerstone Christian Fellowship Parent Handbook lacks background checks, nutrition, or safety procedures, which is troubling. Their staff is not subject to background checks, which is dangerous for the safety of students. The nutrition is not mentioned for their students, so it's anyone's guess as to what they're eating and how they're feeding children there, and their safety procedures are not mentioned. So it is unclear how the children there are being kept safe. And that's found on page 21 and page 64 to 70 in Robertson. The school affiliate at the T-Burn Learning Center. The pros are that the fees are discussed openly on page 5 of the handbook, and the student to teacher ratios are laid out clearly on page 3 of the handbook, and the ratios all align with standards of quality childcare programs, as mentioned on page 24 of Robertson. And the center is play focused, which according to Robertson is how children learn best, on page 258 of Robertson. So it is important to lay out the fees of a child care facility so that parents know what they're getting into, they know what they're going to have to pay. Because when you get down to the bottom line, that's the brass tacks of it all. How much am I going to have to pay for my child to attend your facility? I love that you're high quality, but our budget dictates we can do this. So, and then the student ratios are clearly laid out, and they all align with standards of quality childcare programs, meaning that there are enough teachers for the number of students that they have, and teachers aren't overworked or overtaxed. School affiliate also has 3 cons. Well, there's a lack of specific social environment noted in the handbook, meaning that they mention social environment, but they don't really talk about what that means or how it's going to work. The center also references medications, but does not have a nurse available, which is dangerous. As I mentioned earlier, teachers are not healthcare professionals, and there's no guarantee that they are qualified to give out medications. And there's no mention of payment plans for families who can't afford the center, which if your center is in a low-income area, that is not going to draw families in as they cannot afford the center and can't finish their payment plans. These are the references, the handbooks, and the books that I use to cite them. Thank you very much for listening. And anytime you're going to go through pause this audiovisual presentation and take a look back at the information I presented. Thank you very much for listening.